I again would like to welcome everyone here, and just to get things kicked off, I'd like to share some information with you about Penny. We will have ample time for questions and answers, so please understand we're going to cover a lot of information today. Starting off, we're going to begin with Penny, the name itself. It's funny, Juan and I were just at a healthcare summit today here in the Commonwealth of Pennsylvania. And within the room that we were in, there were probably 100 or more healthcare professionals and individuals in the health insurance profession in the Lehigh Valley in Pennsylvania. And what was interesting about that is that we were a sponsor for the event, and if you had asked all 100 people right out of the gate, how many of you know who Penny is? Maybe two or three would have raised their hands. And of those two or three, I would say that one or two probably didn't fully understand who we are. So I can explain in one name, Penny, who we are. Pennsylvania, Penn. I is insurance, E is exchange. And what do? We get people covered. We get people protected. Going back just a little bit, um, it's funny. I'm actually going to talk about something here that is a piece of legislation that got its birth in 2018. It seems so long ago, doesn't it? 2018, and then was actually signed into law by Governor Wolf on July 2nd of 2019. But prior to Penny's legislation being signed, on an annual basis, we, as a Commonwealth, would sign a check for $98 million a year and send it back to healthcare.gov for the use of their platform. Now, that right there got a lot of forward-thinking policymakers and legislators together in Harrisburg from both sides of the aisle. And they said, we can do this better. We can create Pennsylvania's own version of healthcare.gov. It can be a competitive marketplace where they have more choice. Will still provide the financial assistance that made healthcare.gov such an attractive environment for a lot of people. But we'll also set up a reinsurance program here in the Commonwealth of Pennsylvania that'll help regulate the rates and premiums for our customers. It acts like a thermostat on your wall. So we set up Penny based upon a great idea that came again from both sides of the aisle. In fact, our legislation passed unanimously, bipartisanly, through both chambers of the Pennsylvania General Assembly. And when it was signed into law, there were a lot of good feelings about it. But then there was that reality, wow, we need to bring this thing to life. And that's exactly what we did. On November 1st of 2020, Penny was brought to life. We launched Pennsylvania's first and very own health insurance exchange. Now, I need to back up for a second, just so people are clear on who and what Penny is. We are not healthcare.gov. We are not a rebranded version of healthcare.gov. We are Pennsylvania's own health insurance exchange. Here's another thing that we're not. We are not an insurance company. What we are is we're the competitive marketplace that makes financial assistance available to its customers and provides health insurance that is good quality insurance. You cannot be denied due to a pre-existing condition at Penny. All of our insurance plans, and we have 3 different metal tiers: gold, silver, and bronze. We also sell dental insurance through Penny. Okay. All of our health insurance plans meet the 10 minimum essential benefits that are set forth by the Affordable Care Act as establishing quality care. Everything from maternity, newborn care, um, substance abuse, mental health services, prescription drug services, of course, hospitalization, outpatient care, emergency, urgent care. Um, the list goes on. But I need to impress upon everybody that insurance through Penny is not junk insurance. We do not permit the sale of junk insurance through Penny. And that's a subject for a different day. Right now, what to keep in mind is that we are the official replacement for healthcare.gov here in the Commonwealth of Pennsylvania. We're the home for high quality and affordable health insurance, and the only source for financial assistance. We get asked this question a lot, Juan and I. Well, what's the difference between going through Penny or going directly to, UPMC or Highmark or Geisinger or Capital Blue Cross or Independence Blue Cross? Guess what? Great. Great. If you want to go directly to the carrier and get insured, fantastic, as long as you get protected. Because right now, 1 in 20 of our friends, our neighbors, maybe even some of our family members get up every day in Pennsylvania and they go out into the world without the protection that is afforded by health insurance. If 2020 and 2021 have taught us anything, it is people deserve good quality protection at a price that does not break their backs. More on that here in a minute. But who do we help? Who does Penny help? Penny is here to help individuals who don't qualify for Medicaid, who don't qualify for CHIP, who aren't old enough yet to qualify for Medicare or Medicare options. We're here to help individuals who don't have access to employer-sponsored coverage through their job. We're also here to help individuals who might work 2 and 3 part-time jobs and not have access to health insurance. We're also here to help individuals who, don't have a job. If anybody, and I'm sure there are a few of you here that, you've received that Cobra letter in the mail, and after you're waved off of the floor with smelling salts, you realize very quickly that you need to look for options because health insurance is expensive. Penny's here to make sure that you have options. Now, I mentioned medical assistance and CHIP. When people contact Penny, oftentimes, they're in a position where they may qualify right out of the gate for Medicaid and CHIP. Well, the good news is that because we're a Commonwealth agency, we're a state agency, we have an incredibly good relationship with the Department of Human Services. And our goal with that is really, really simple. It is to make sure that if people contact us and they're eligible for Medicaid or CHIP, that they get a warm transfer from Penny. Even their application information transfers to someone who can help them secure their protection. Because again, I keep coming back to this, but this is why we're here. What is most important to Penny? Getting you covered. helping you protect your quality of life. That is what's most important to Pennie. Okay, so we have a no wrong door policy that quite literally, we make sure if you need resources, you get the resources you need to get covered. Um, Now, in terms of how Pennie helps, we have an online self-service portal, pennie.com. It's very nice. We're very proud of our site. There were a lot of people when we first launched our site, there were some folks actually here at the Commonwealth level that were, saying, well, how are people going to know to trust you because you're a .com and you're not a .pa.gov or a .gov. And quite honestly, Pennie's legislation and our approach as an organization is we want to get the GOV out of um, Pennsylvania's exchange. We want people to be able to approach us if they have concerns. There's a lot of fear and a lot of apprehension about health insurance. If you mention health insurance to most people, they look at you like you gave them a glass of lemonade without the aid part. They have mixed feelings, justifiably so. So we created our online self-service portal so people could poke around and shop on their own terms. You don't have to come to Pennie and create an account in order to figure out whether or not you qualify for financial assistance or compare and shop plans. That's something you do on your own terms with us because it's your choice and it's your decision ultimately. But we know that not everyone, in fact, nobody was born with an inherent knowledge of health insurance. So what we do is we have different layers of service available to you. We have our customer service representatives at 844-844-8040. We'll have more information on those here in a minute. But our customer service representatives do not work for insurance companies. They work for Pennie. They work for you. And they're here to provide no hassle, unbiased, absolutely unbiased service to you and to help you answer your questions about, do I qualify for financial assistance? What kind of plans are available in my market? What's the best options for me? I need to make sure that certain doctors, certain prescription drugs, etc., are in and covered by my insurance plan. They can help with that. And they can also help you secure your insurance, health or dental, right over the phone. But here's the thing. We know that not everybody likes to work online. Not everybody likes to work over the phone. So we, in communities across Pennsylvania, we have Pennie certified brokers, thousands of them, thousands of Pennie certified brokers. And they are truly the only licensed professional in the Commonwealth of Pennsylvania that can make a professional recommendation on your behalf. Unlike our customer service representatives who will educate you, but let you make the decision that's best for you. You can go to a broker if you have an incredibly complex set of healthcare needs. Our brokers are the very, very best at being able to help people get the absolute perfect plan for their needs. In communities as well, through hospitals, health centers, faith-based organizations, and community organizations, we have our registered assisters. Our Pennie certified assisters are registered with the insurance department here in Pennsylvania. Many of them, it is their calling in life to work with individuals to help them understand their health insurance options. And again, like our customer service representatives, a Pennie certified assister is unbiased, can provide no hassle assistance to you as you search through different plans and options. They are an incredible resource. Speaking of why we need those resources, you heard me mention before that 1 in 20 of our friends and neighbors here in Pennsylvania are uninsured. What this heat map represents is it represents 607,000 souls, people that in, as I mentioned, in 2021, heading into 2022, there is no good reason why we can't help get more people protected here in the Commonwealth of Pennsylvania. Granted, a lot of folks, they look at, the dark blue places like Philadelphia, Montgomery County, Chester County, Bucks County, Lancaster, you know, they look at places like that and they think, well, gee, that's a lot of uninsured people. And you're right. But population density aside, you can also take into account places like Crawford, Mercer, Westmoreland, Washington, Greene County, Fayette County. Fayette County, 9,800 uninsured. Now, given the population of Fayette County, that's significant. That's something that we need to be concerned about. And it's like that throughout the Commonwealth. Um, we've got our work cut out for us, Juan and I. And it's where we need as much help as we can get in terms of being able to reach out to folks and let them know why we're here and who we're here to help. Now, speaking of help, and this is where we're going to get into some scenarios that'll help drive this point home. Again, I'm going to remind everybody of who Pennie is here to help. We're here to help people that don't qualify for Medicaid or CHIP, people who are too young to qualify for Medicare and Medicare options, people who might be between jobs, people who don't have access to employer-sponsored coverage, small business owners, sole proprietors, small precision manufacturers, agribusiness owners. Um, Basically, we are here to help people that fall into that middle ground, that individual health insurance market where they, not their employer, not, you know, not some other entity is covering their health care. We've got great news, very, very good news. Um, the American Rescue Plan has removed the subsidy cliff for individuals who, through the marketplace, normally wouldn't receive health insurance or subsidies to support them in paying for their health insurance. Before the American Rescue Plan, if you were an individual that made $51,000 or more a year, you did not qualify for financial assistance. You could qualify for an affordable plan, but you wouldn't get any help paying for it. It's the same way if you were a family of four that were, over 105. Now, what's so unique about plan year 2021 and the plan year that we're heading into 2022, what's so unique about that is that we are capping premiums at no more than 8.5% for families or individuals who are in that scenario where they make more than 400% of the federal poverty line. Now, that's really, really good news because that means that all levels of financial assistance at Pennie have been enhanced for both 2021 and 2022. And there's a question that comes up. Well, what happens 2023? Well, guess what? The policymakers and the legislators are already working very, very hard to actually address that concern. So please understand, our goal is not to set people up for failure. Our goal is to make sure that people stay protected. That's our goal. That's our singular purpose. My partner Juan is going to go over some scenarios here that'll help demonstrate why the financial assistance through Pennie is something that has literally, as of this morning, provided us with 340,000 customers and change when we started and launched here at Pennie when we started and launched here November 1st of 2020, we had migrated about 280,000 customers over to Pennie from healthcare.gov. So we're growing. We're growing because there's a lot of good news. So Juan, share some good news, my friend.
Thank you, Scott, and thank you, everyone. We really appreciate this opportunity that you guys are providing to talk to your members and bring some resources that are available for many residents of Pennsylvania. We are new. As Scott mentioned, we are only 1 year old, and a lot of people don't know anything about Pennie. Some of you own your own business, a childcare, and as you may know, in many of these type of business, you may have employees that are part-time. Perhaps you don't provide health insurance, and it has been challenging for you to attract employees, perhaps. And one thing that we said is, if you own your business, right? You and your spouse, and maybe you have 1 or 2 employees. How can you get benefit of Pennie? And at that particular moment, we said, as a self-employed, you can come to Pennie and get a financial assistance. And each of your employees, if you have 1, 2 employees, they can also enroll at Pennie individually, but they will have to do it themselves. So they can come and enroll at Pennie if they are not having health insurance at that particular place. So that is a solution for many of the members, as we mentioned, that own this type of businesses and are self-employed in Pennsylvania. Let's go over a few scenarios so we can visualize better what is the impact of the American Rescue Plan, which honestly has been huge. That plan was signed in March, and this is how it affects. So the first scenario is this individual. He's single, 40 years old. He lives in Philadelphia County, is non-smoker, and is making about $19,000 a year, right? Prior to the American Rescue Plan, this individual was paying a monthly premium of about $66 a month. That's $792 a year. Under the American Rescue Plan, this person is now paying $0. And it's significant. If you think about it, someone that is making almost $20,000 to save about $800 a year, it's important, it's significant. So like him, right now, which is very interesting, we have at Pennie 340,000 customers in Pennie, and 53% of our customers are paying $1 or less a month for health insurance. So it's huge. Right now, the American Rescue Plan has literally helped people to have access to high quality health insurance and dental insurance. Let's take a look at the second scenario. This is very close to many of us that have parents, and this is a married couple. They are 64 years old, right? The older adults in our communities, non-smoker. They live in Dauphin County, and between both of them, they make about $77,000 a year. Prior to the American Rescue Plan, they will be paying a monthly premium of $2,400 for health insurance. That's almost 38.1% of their income is dedicated for healthcare. Older adults, unfortunately, in our system are paying a lot of money for health insurance. Under the American Rescue Plan, you remember that Scott mentioned that the percentage of income will be capped at no more than 8.5%. That means this couple will be paying only $550 a month. So literally savings for this couple about $1,900 a month. So almost $23,000 a year. They can literally buy a car. So this type of savings are huge for a lot of the people in our communities, but they don't know. And that's honestly one of the reasons why we appreciate that we have this opportunity, because I'm sure you may know someone in your family or a neighborhood, a neighbor that is in this type of situation. Our third scenario is a family of four. They're non-smokers. They live in Allegheny County, and between all of them, they're making $52,000 a year. Prior to the American Rescue Plan, this family was paying $285 a month, about $3,420 a year. Under the American Rescue Plan, this family receives financial assistance and is paying now only $87 a month. So it's less than $20 per person, which is important. So this family is right now saving about $198 a month. So as you can see, these three different scenarios, it is a way to show how important is the American Rescue Plan and how it's affecting our communities. So again, when 50% of our customers are paying $1 or less, that's incredible. 68% of our customers are paying $50 or less a month. Since we made the transition in Pennsylvania to get away from healthcare.gov, the federal marketplace, and Pennie, and transfer to Pennie, we have gained 65,000 new enrollments. So that is also significant. Of course, it has been in the middle of this pandemic, but we have been able to help a lot of people to receive that financial assistance that people deserve. Why this is very timely, this presentation, and it's important because when can you get enrolled in the marketplace? Well, we open the marketplace November 1st, and our first deadline is going to be tomorrow, December 15. So you need to enroll before December 15 if you want to have protection or start having insurance from January 1st. Let's say that you missed this opportunity to start in January 1st with coverage. You still have time until January 15, okay, to get protection starting in February 1st. So that is important because it will help a lot of people that still don't know anything about Pennie, that they can enroll. So this is a great time to enroll. This is happening every year, what we call the open enrollment. So it's November 1st to January 15. Now, it's important to mention that outside our open enrollment, outside this time, right, there are certain qualified live events that will allow you to come to the marketplace, to come to Pennie.com and get health insurance if you have those qualified live events under a special open enrollment. Like what? A change in your household. You get divorced, or you get married, or you have a baby. At any time during the year, you can come to Pennie.com and get enrolled. If you are in incarceration and you get out, at any moment, you can come to the marketplace and have at least that part secure, which is your health. It's important. That is also important. Now, let's see that you are coming from another state to Pennsylvania, to live in Pennsylvania, or you move from one zip code. I live in Lancaster, and if I move to Exton, PA, that's a different zip code. Therefore, the health centers there are going to be different from the ones that I have here in Lancaster. That is a qualified life event that allows me to go to the marketplace, to Pennie.com, and change my health insurance plan. So those qualified life events are also important, and that's why we're doing all year this type of seminars, education seminars, so people understand that they have options outside of the open enrollment. Okay. Now we just want to remind everyone about our basically 4 type of services that we provide here at Pennie. They are all free. Our call center, we have been able to have an excellent service and timely matter for our call center. Just to give you an idea, right now we're receiving about 4,000 calls a day here in Pennsylvania, and we have 260 people literally answering the phone. We have Spanish bilingual representatives, and we have a language access that doesn't matter. That it goes up to 240 different languages. So we make sure that everyone has access to communicate with us in their language. We can explain everything, how to do the enrollment, and if you are eligible or not. It's important also to know that we have these two different networks, the brokers that are licensed in Pennsylvania, that they can narrow down different health insurance plans and help you to choose one. Also, our Pennie assisters, which are very important. Those Pennie assisters usually work for health centers or nonprofit organizations, so they are unbiased. These people are very strong in education. Some of them speak different languages, and they have these relationships with the community. We're increasing a lot on the number of assisters across Pennsylvania, and we're reaching out to different type of communities that usually are underserved or underrepresented. The Hispanic community, the LGBTQ community, the African American community. We're trying to get as many different communities as we can with Pennie. And lastly, you can come to pennie.com and send us just a question. So remember, we have one 800 number. It's very easy. It's 1-844-844-8040. You can also see the phone number as soon as you go to pennie.com. During open enrollment, our call center is open from Monday to Friday, from 8 a.m. to 7 p.m. And Saturdays we're open from 8 a.m. to 1 p.m. See the next slides.
Yep.
Perfect. So we end our presentation, but we want to open the floor literally to have a conversation with everyone about if you have any questions, if you have any concerns about Pennie, please feel free. That's actually the reason why we are here. Again, we are state employees. Our job, literally, Scott and I, our job is to serve the residents of Pennsylvania, here to answer your questions and try to communicate and contact with other organizations like yourself.
All right. Well, one thing, if we have a couple minutes, okay, there's a question from Pamela. If your employer offers coverage, whoops, I kind of got away from me. Hold on here. Let me pull up the chat. If your employer offers coverage, does that qualify or disqualify you for Pennie? It does if the coverage is affordable. Okay. If the coverage, and that's the law, Pamela, if the coverage is deemed affordable, then that's the health insurance that you have. It again, with some employers, they can provide you with a really good job, but there are a lot of organizations, especially nonprofit organizations. I know a lot of the nonprofits that Juan and I work with, they can offer really, really good jobs and careers, but some of them don't offer benefits. That's where Pennie comes in. We come in to help people get protected. Okay, by affordable, do you mean no more than the 8 point? But yes, Angela, that is correct. That is correct. We are as a state-based exchange, Angela, Pamela, just so that you know, one of the really nice things about being a state-based exchange is that some of the challenges that healthcare.gov has had, we're in a position where, because we have local control in Pennsylvania, we can help remedy some of those situations over time. So please understand, there are a lot of folks here at Pennie that want to see people protected, and done so affordably. So we're going to do our best. Were there any other questions? Okay, well, I think if we have a couple minutes, are we okay, Jen? Okay, if we're okay, okay. Are there minimum hours work requirement for employees to qualify? Our childcare workers' hours vary. And you know what? A lot of people who are under or insured under Penny fall in. There are a lot of people, especially from out east. There are a lot of people who are gig workers. And down in Pittsburgh, there are a lot of people working gigs now just to make ends meet. And if you have an income that fluctuates, that's another question that we get. If our income fluctuates because hours fluctuate, ergo the income fluctuates, the best thing that you can do if you qualify for insurance through Penny, and your hours and income tend to fluctuate, if it's drastic, please reach out to us and let us know so that we can help you adjust. Okay, now what does that mean? Well, that means that you may be in a position where you actually qualify for more assistance. Okay, now the adverse is also true. If you find yourself in a position where you're making a little bit more, you want to put yourself into a position where you contact us so that we can adjust so that you're not penalized at tax time. Um, is this an annual renewal or how often recertification? Angela, as far as health insurance at Penny goes, what we do is we have customers, in fact, uh, uh, I just saw the number this morning for our auto renewals. I want to say, and Juan, keep me honest on this, is it like 86%? Was that the ballpark that we were in? Okay. So about 86% of our customers are individuals that, like most of us, once we have our insurance figured out, we just want to set it and forget it and back away. But what we do here at Penny is, you know, we do uh, encourage, and about 10% of our customers are active renewals. Those are customers that come back to us and say, hey, look, I know there's more financial assistance. We need to make sure I'm getting the best for my buck and that I've got the best plan as well, because plans change. What health insurers offer, it changes. They develop better plans, better options. So um, it's not a one size fits all, but with regard to with regard to the annual renewal, um, there are certain facets that you will want to review and renew, things like your income. Has it
Yeah.
gone up? Has it gone down? And go ahead, Juan. Yeah.
No, Angela, I also want to mention something that is interesting. So because Penny is the marketplace, right? Insurance company come to Penny, and for next year we have new players, which is really good because what happens is it provides competition between this insurance company that at the end serves you, the residents of Pennsylvania. So we have new players. Those new players have new health plans.
Yeah.
So we want to make sure that we encourage every one of our customers is double check, call our 1-800 number, see if you are in the right plan. If you want to explore for something else, go ahead and shop around. But what is the beauty of Penny is that Penny, it's a marketplace, and that competition between insurance only benefits our customers.
All right. There's a great question from Jasmine. Her husband is in a position. Whoops, hold on one second here. Her husband's in a position where he's going to be laid off before April 1st. Um, when should you start looking into Penny? Well, I'll be quite honest with you. I would start looking into Penny in anticipation of that layoff. In other words, to your first question, or I should say your last question that was on there, is this a qualifying life event? Yes, it is a qualifying life event. Um, any loss of employer-sponsored coverage will immediately open up a 60-day window where you and your family can shop for health insurance options through Penny. So if the anticipation is that he's going to be laid off at some point April 1st, it'd be a good idea sometime in March to reach out to 844-844-8040 and talk with one of our customer service representatives. The reason being is because ideally, in a perfect world, what we want to achieve is a seamless transition so that there's no gap in protection for you and your family. Okay, that's my advice. And again, this is Pennie.com. Here, right up here is the 844 number that Juan was mentioning. You can click to call. It's very, very simple. But we have some other questions here. Teresa had a question. If an employer offers insurance for an employee that cost is less than 8.5%, but you need to cover the family, and that cost puts the cost above the 8.5%, can you use Pennie to get coverage for your family? Well, it's all based upon the formula for what is affordable and not affordable. Okay. If providing for your family makes that additional cost go up beyond the 8.5%, indeed, you need to reach out to 844-844 or 8040 and talk with one of our customer service representatives. Okay. It's important to know that that figure is something that has provided challenges for folks since the advent of the Affordable Care Act. So it's on our radar, but that's a good question, Teresa.
And two things I want to mention as
Yeah.
well, Scott, that if you get laid off at
Yeah.
any time during the year, at any time, if you lost your health insurance because you lost your job, you can come to the marketplace at any time. So that's important. Now, another part is like sometimes you get a job and they said, we start giving you health insurance after 3 months, after 90 days. That's what they said sometimes. You can come to the marketplace and get health insurance for those 3 months before the health insurance from that company starts. So Scott is going to show everyone how easy it is to navigate our website. This is an interesting. We invite you to follow Scott at this moment.
Yep, but we have two questions, one from Angela. And Angela, to your question, would Pennie Assisters be willing to show up and do a presentation for your staff? Indeed. All that you would need to do is do what I'm about to show you. There's a part here that I'm going to show you. If you could do me a favor, Angela, drop your zip code wherever you are at. Drop your zip code into the chat so that I can use that for the demonstration, and I'll show you exactly how easy it is to connect with our assisters. And then Jasmine, you had a question. Thank you so much. All right, there we go. All right, I have got it. And Jasmine, you had a question. Also, what if he leaves before he gets laid off and starts his own business? Hey, you heard me say before, Pennie's here to help sole proprietors, small business owners, gig workers, agribusiness owners, small precision manufacturers. Basically, if he decides that he wants to pull away from his employer, and believe it or not, we saw a lot of people doing that in 2020 and 2021. They were like, you know what, this working some days, working not some days. I've done this for 12, 15 years. I'm going to hang my own shingle and open up my own business. And there were a lot of people that did that. And we have a lot of people here at Pennie who, and you know, that's a very good question. Let me go ahead real quick while we have time. I'm going to just go over some facets of Pennie.com. Again, one of the things that Juan pointed out early was the fact that we have multiple languages available to help support customers at Pennie. If you call the call center, we have English and Spanish customer service representatives, and we also have option number 8. It puts you in touch with our translation line. We have over 240 different translators available to help people whose primary language is not English understand health insurance. Now, let me say that again. Imagine how frustrating and confusing health insurance is for somebody who speaks, English, for somebody whose primary language is not. would you want to be in a position where you were signing documents and signing up for, giving your money away to it can get really confusing. So please encourage folks to take advantage of our translation services. In this case, you'll see that Pennie.com actually has 10 different languages that we can translate the entire site into. Right now, I'm feeling like Russian. So there, we just translated Pennie.com into Russian, okay? And the reason that we do that is because we want people to feel comfortable when they come to this site. This is a resource site. Speaking of resources, and back to the question about the assisters, and just to showcase again, you're never alone when you're at Pennie.com. You can click to call our customer service center here. You can click here to find a Pennie certified broker, or if you want to click and find an assister, you click find an assister. Now, what we're going to do is we're going to put in 18853. We'll open it up to about 10 miles and see. You can also select by language if there's a language preference, or the organization name if you know the assister organization. But we're going to go ahead and pull that up. Bear with me here. Let's see. Our assister network isn't as vast as our, there we go. There we go. All right, this is Northeast PA and the Burke Center. And knowing both of these centers and knowing the fact that they are, just over 20 miles, I know that they would work with you. In terms of NEPA, you click on the organization and then show the assisters. And Taylor is the assister there. Now, there are more assisters at NEPA, believe it or not. And the Burke Center, you can click on the Burke Center. And also with the Burke Center, you've got Donald Miller, okay? So within reasonable driving distance of your area, you have individuals that can come directly to your facility. And like I said, they would be more than gracious about coming and helping your employees. And again, our assisters, they're unbiased. So, oh, Donald. Well, there you go. Life is good. The one last thing, and I know we are coming up on time here, but the last thing that I am going to demonstrate is how easy it is to actually connect with a health or dental plan here at Pennie. If you click on that gold, and I'm going to go back there again, just so everybody sees it, this gold Get Covered button, okay? Anybody can do this. 4 easy steps, no personal information. You can click on Browse for Health and Dental Plans here in the middle. You click on that. This is Pennie's Plan Comparison Tool, okay? When you go in, it's going to ask you what coverage year are you looking at. Here's the coverage year. Enter a zip code. We're going to go ahead and enter that Bradford zip code again, okay? I'm going to put in, for the sake of time, just an arbitrary date of birth. We will say 09, 28, 19, whoops, not 18, 1985. There we go. And anybody in your family who's seeking coverage gets a blue check mark. So like Juan had pointed out, you can add your spouse, you can add dependents. Just make sure whoever needs the health insurance gets the blue check mark. And you might have a scenario where you and your spouse might need, or you might need protection, but your children are covered under CHIP, which is fantastic. So, that's always an option. I'm going to put in 27,000 for an income. Immediately off to the right-hand side, you will see if you qualify for savings lit up. Why is that important? Well, it's important because people want to know if they qualify for savings. In this market, this individual would qualify for $271 a month in advanced premium tax credits. Those tax credits immediately reduce the monthly premium for a customer at Pennie. Also, we have 3 different metal tiers: bronze, silver, and gold. If this individual were to choose a silver level plan at Pennie, they would also have cost sharing reductions. And those cost sharing reductions eliminate those things that turn your hair gray like mine. Things like copays, coinsurances, deductibles, the things that people really enjoy sitting down and reading about. Speaking of, if you or someone you're trying to help with this, if they don't understand what coinsurance is, anything that's underlined on the Pennie website, you can hover over it and it'll tell you what it is. Okay, so if you don't understand what what coinsurance means, this will explain in detail what that coinsurance is. But like I said, I wanted just to show everyone, here's where, if you have a specific concern, like I need to make sure my family doctor is in on this list. I need to make sure that my family dentist is on this. Prescription drugs, you can add all this information and drill down. But again, for the sake of time, I just want to show you what it looks like when you shop for plans. Again, have I asked anybody for a name, an account setup, social security number, cell phone number, email address? No. The reason being is because we want people to be able to shop. And in this market, there are 48 plans, 48. You've got plans by PA Health and Wellness. And no, those aren't errors. That's actual numbers. Geisinger, Highmark, and the list goes on. We probably have, yeah, that's what we have. We might even have some UPMC in here. But long story short, if you want to be able to sort these by monthly price, you'll see that Pennie has $0 options. If we want to take a look at the best of the best, Pennie also has gold options that are very affordable. And again, this is not junk insurance. These are insurance plans. And this Highmark plan, this is a gold EPO. Those are $0 deductibles. That is the American Rescue Plan at work. And that is why we will fight so hard to make sure that people in this Commonwealth know that there has not been a better time for individuals to get protected and to do so. We would love to see everybody do it before tomorrow, but we know that's not realistic. But again, January 15th, 2022, we can get you insured by February 1 or at any time throughout the year. If you have a qualifying life event, come see us. Again, thank you so much, everyone, for taking time out of your day to learn a little bit more about Pennie, to give us some really good questions.